Hello. Today we will review how to write an ophthalmology note in ORCHID, the EMR system used in Los Angeles County DHS. We will start with customizing your login to make it easier to write and find ophthalmology notes. We will then review how to write notes, order meds and procedures, bill, and perform med reconciliation. We can start with cleaning up your home page so it only has a workflow tab for writing notes and an ophthalmology tab for billing procedures and orders. ORCHID has a lot of redundancy. You should eliminate unnecessary tabs. For the exam, we only need the following: chief complaint, HPI, exam, visits, documents, histories, home meds, problems, and assessment and plan. Now that your workflow is set up, you can write exams by filling in the necessary components. Your medical note should document your findings unique to the day of your exam. The chief complaint often comes from the ad hoc form filled out by the nurse or technician. The HPI can include some historical data but should be unique to the status of the patient today, the current visit. Vision and pressure are stored in the ad hoc form and can be brought into the document using .optho. You should create a template eye exam, but make sure it is accurate for the current day's exam, especially if copying and pasting. The ad hoc form for ophthalmology stores vision, pressures, and other valuable ophthalmologic measurements so we can see previous measurements. If a technician or nurse checked vision, they will open an ad hoc form for the visit. You can reopen it by double-clicking on it in the document area. If you need to open a new ad hoc form, you will need to click on the ad hoc area, then ambulatory, then ophthalmology. Visions, IOP, pachymetry, refractions, visual field findings, and OCT findings can all be stored here. After saving the ophthalmology ad hoc form by clicking the green check mark, the form is available in the results review area. It can be compared with previous visits. To see only the ophthalmology results, go to Ambulatory View, change to Group. Click on the three dots and type Ophthalmology and hit Enter. Click on Ophthalmology and then pick OK. Now you can see historical vision and pressures for comparison in tabular form. You can copy and paste it into your note if you'd like. However, the formatting is not always consistent. Use the Documents tab to easily pull up old documents. Filter it for physician only to narrow down your choices. Ophthalmology attendings can choose to only have ophthalmology notes in this section, but residents unfortunately do not have that option. It is often easier to find ophthalmology-only notes using personalized filters in the documentation section. We will set those up later. The Visits tab shows past and future appointments. It's always a good idea to check here to see if patients have been seen at other sites or if they have follow-ups. Pre-reg means they no-showed their appointment. Outpatient indicates they completed that appointment. Consolidated problems. This is the section for the past medical history and the patient's diagnosis. Problems that are current to today's visit. Confirm the patient already has their diagnosis for today's visit in their problem list. If so, then just click on this visit to make it today's diagnosis. If not, then you can manually enter your diagnosis for today's visit. Problems that you make chronic will carry over from visit to visit. Assessment and plan. In this section, you enter your findings and plan for each diagnosis you are addressing today. When you are done, click Select Other Note, and it will use the information you entered to create your document. There are several different ways to create a new note in ORCHID. We can personalize which notes appear as options for you to write. This will make it easier to default to the note used most often, the Ophthalmology Outpatient Provider Note. Notes are filtered most easily by their type. There are only three types of ophthalmology notes that we use. The Ophthalmology Outpatient Provider Note is used for all exams in eye clinic no matter who is writing it, attending, fellow, or resident. It is used for exam notes, procedure notes, and any telephone notes. Ophthalmology consultation is only for emergency department consults and inpatient initial consults. Ophthalmology inpatient is only for inpatient follow-up notes or patients admitted to the ophthalmology service. It is helpful if you type the title of your note, outpatient, consult, or inpatient follow-up, so it can be easily found. You will need to create a filter to easily find all optho notes. Click on the three-dot button, then make a new filter and add outpatient notes. It may be helpful to include the nursing notes as well. Click Apply and then Save. A separate filter can be created for surgeries. It is not possible to sort ophthalmic surgery notes as separate from other surgeries in H&Ps. However, it is still useful to be able to easily find surgical notes. Remember, all your lasers and intraocular injections will sort to ophthalmology outpatient notes. There is no way to easily sort out procedures by notes alone. We can keep track of all procedures done in the eye clinics by entering them into the procedure history each time they are performed. These historical procedure dates will then carry over to all future exam notes. It is a good way to keep track of previous lasers and injections. You can also manually enter previous procedures in the history section. The exam you have entered in from the workflow pulls into your ambulatory care exam note. It is not acceptable to use a free text note as it is not considered a billable note for a medical exam. You can edit and sign the note. If you order medications or procedures before signing, they will appear in the note, but it tends to appear disorganized. You will need to write separate notes for procedures and exams, even if you've done on the same day. This makes it much easier when reviewing notes to get an idea of the patient's history. You will need to sign your exam note and then start a new ophthalmology outpatient note with the procedure template. After finishing your note, you will need to make sure all orders and billing are complete. It is easiest to refill meds from the Workflow tab. Please do not order medications that you could just refill instead. This confuses the pharmacy and creates redundancy with the same drops listed over and over again. DHS pharmacies can only take prescriptions from a physician located at the same physical location as the pharmacy. You can write for any pharmacy located outside of DHS or the DHS pharmacy at the site you are working at that day. If the patient wants drops at another DHS clinic site, you can request that their PCP write for them at that site. You must be on ambulatory order prescription to write prescriptions. The Ophthalmology tab is designed to be the place where all orders are submitted. It can also be customized by eliminating ones that we do not need and color coding for easier navigation. All dilated eye exams should be coded with 92004 or 92014. This lets ORCHID and the PCPs know that a diabetic eye exam was done and the patient should not be sent for teleretinal screening. In order to count and bill procedures, we must enter a CPT code. This includes PRP, intraocular injections, and glaucoma lasers. When considering follow-up, remember that many patients with low-risk eye problems should be followed by optometry and not ophthalmology. Help keep our ophthalmology clinics free from backlog by sending all moderate NPDR without DME, early glaucoma, and stable pseudophakic and dry eye patients to optometry. In anticipation of forum and to order and bill for ophthalmic diagnostic procedures, we must enter the CPT codes from the Ophtho Diagnostic Procedure Order Set. You will need to follow different ordering pathways depending on when the testing will be done. Medication reconciliation is required in EMR documentation. Usually the technician or nurse will do the initial documentation history, but you can also do it if it's not already been done. You will need to approve all future drops and other medications ordered, such as dilation or post-surgical drops, by clicking the green triangle in those boxes at the bottom. Medication reconciliation is completed when a green check mark appears. The recycle sign means it wasn't done correctly.